So this was an exploratory qualitative survey, which is a pilot study aimed to evaluate the current criteria for diagnosing cannabis use disorder by using a newly developed set of assessment questions called the Cannabis Assessment Reliability and Validity Evaluation Tool, otherwise known as the CARV tool. The purpose for this tool is to expand upon the diagnostic statistical manual criteria for cannabis use disorder to further identify appropriate versus inappropriate cannabis use by evaluating medical usage, legal usage, and assessing a patient's knowledge, purpose, intent, and outcomes for cannabis use. The CARB tool was developed as an extension of the DSM-5 criteria for cannabis use disorder to also include current cannabinoid research and considerations regarding the NCSBN National Nursing Guidelines for Medical Marijuana published in the Journal of Nursing Regulations in 2018. During the literature review process, CUD diagnostic tools currently in use were discovered and explored. However, the tools currently in use, as well as the diagnostic criteria, do not fully address the question of appropriate and inappropriate cannabis use. The review also exposed evidence to support a gap in knowledge regarding cannabis use and misuse, not only within patient populations, but also within healthcare provider population, including those in current nursing leadership roles. Cannabis policies are changing rapidly throughout the United States. The National Nursing Guidelines for Medical Marijuana details the importance for nurses to be aware of changing laws and policies in states where they are licensed to practice. There is a map that can display all of the state's differences, and it is very important as practicing nurses that you're aware of your state policies, not only for THC, but all of the cannabinoids that are there and hemp products. As healthcare providers, it can become confusing as laws are changing and new information is discovered through research. However, understanding state laws surrounding cannabinoids and cannabis access may be useful to consider when determining a cannabis use disorder diagnosis. This study aimed to answer two main questions. First and foremost, could appropriate and inappropriate cannabis use be measured and separated? And secondly, did the criteria covered in the survey provide a complete assessment of cannabis use and cannabis use disorder? The target population for this study focused on healthcare providers with the ability to diagnose cannabis use disorder. The CARB tool was developed as an inclusive, cohesive, and functional tool which can help determine appropriate and inappropriate cannabis use when considering a cannabis use disorder diagnosis. A study conducted by Kartzman et al. In 2022 states that nurse leaders report being unaware of existing national nursing guidelines for medical marijuana. Nurses also reported a gap in knowledge regarding cannabis use and endocannabinoid system care. The study concludes by stating that nurse leaders were supportive of cannabis legalization and viewed nurses and nursing organizations as central to patients' acceptance of access to and use of medical cannabis. Additionally, statistical data from 2019 reports that 18% of Americans have used cannabis at least once in the last 12 months. Research also estimates that approximately 3 in 10 people who use cannabis have cannabis use disorder. Utilizing the CARB tool to help determine appropriate versus inappropriate use also assists healthcare providers in guiding patient conversations around cannabis use and misuse through a valid and reliable method. The National Nursing Guidelines for Medical Marijuana were published by the National Council of State Boards of Nursing in 2018. The guidelines address 6 principles of essential knowledge, including legalization of medical and recreational cannabis use, principles of medical cannabis program, the endocannabinoid system, cannabinoid receptors, cannabinoids and interactions between them, cannabis pharmacology and research, facility policies for medical cannabis, as well as clinical encounter and ethical considerations. Additionally, California recently passed a law called Ryan's Law that allows terminally ill patients to use cannabis in hospitals while receiving inpatient care. Patients are using cannabis and hemp-based products. The CARB tool holds potential as a resource to guide cannabis use assessments while evaluating appropriate and inappropriate use, and may assist with identifying gaps in knowledge for teaching and learning opportunities. The participants' feedback was used to help answer the study's 2 main research questions. First, could inappropriate and appropriate cannabis use be measured and differentiated? Secondly, did the criteria covered in the survey provide a complete assessment of cannabis use and cannabis use disorder? What is cannabis use disorder? According to the DSM-5, the definition of cannabis use disorder is a problematic pattern of cannabis use leading to clinically significant impairment or distress occurring within 12 months. The DSM-5 states that a patient experiencing 2 out of the 11 criteria qualified as clinically significant, leading to a diagnosis of CUD. The literature supports the ever-changing legalization policies that are independently driven state to state, separating medical cannabis use and recreational cannabis use. Healthcare providers and nurse leaders report limited knowledge and understanding of determining appropriate and inappropriate cannabis use within their patient populations. There were no costs associated with this project. Participants were not offered any monetary incentive, and there were no costs associated with recruitment or survey administration. This exploratory qualitative research study was accepted and approved through Salve Regina University's Institutional Review Board on November 16, 2021. An addendum was approved to add additional organizations to the third-party email list in attempts to increase healthcare provider participation in February of 2022. The Cannabinoid Assessment Reliability and Validity Evaluation Tool is a 21-item inventory designed to measure the following facets of cannabinoid usage from open-ended questions that were based on the constructs from recent literature and the DSM-5. Individuals must meet at least 2 of the 11 symptoms that assess cravings, withdrawal, lack of control, and negative effects on personal and professional responsibilities, to name a few. Examples of the criteria are a problematic pattern of cannabis use, and much time is spent in activities necessary to obtain cannabis. It may be useful to also assess patients' understanding of their own cannabis use. For example, the CARB tool asks questions such as, are you a medical cannabis patient? And if yes, what is your qualifying condition? The CARB tool also poses questions to assess how patients are using cannabis, what patients are using, what side effects are they experiencing from using cannabis, how and where they acquire their cannabis, what type of cannabis products are being used, and who is providing instructions for this use. These questions are important to further assess and evaluate appropriate versus inappropriate use, as well as revealing gaps in patient knowledge where teaching and learning opportunities could potentially provide better health outcomes. Implementing the CARB tool could meet both the patient's personal health goals as well as providers' goals of increased quality outcomes, while reducing harm related to inappropriate cannabis use as well as risk for cannabis abuse or cannabis use disorder. There were multiple organizations that were asked to participate in the provider review. Research Society of Marijuana, Hartford Hospital Emergency Department, the Association of Cannabinoid Specialists, and Cannabis Nurses Network, to name a few. The research was a double-blind study which used a third-party investigator to obtain healthcare providers' surveys for full anonymity. An exploratory qualitative design was used in this pilot study because the outcome was unknown. Assessment of the data obtained through Qualtrics from the provider review and analysis indicates that the CARB tool supports the determination of appropriate and inappropriate cannabis use. Latent thematic analysis was necessary to ensure participants' comments were captured, including provided recommendations. Core themes and potential sub-themes were systematically and methodically generated. Themes were generated from the qualitative data and then evaluated for common themes in the healthcare provider answers. Therefore, a complete assessment of cannabinoid use was obtained. The research study also addresses the ability to develop an approved assessment tool for diagnosing cannabis use disorder, utilizing inclusive, cohesive, and reliable measures to determine appropriate and inappropriate cannabis usage. Hypothesis 1 asked if appropriate and inappropriate use could be separated. The findings were significant, as seen by a p-value of 0.01. In the second hypothesis, participants who agree that the CARB tool provides a complete assessment of medical cannabis use also agree that the tool provides a complete assessment of general cannabis use. Healthcare providers were able to describe or provide comments on any individual item throughout the entirety of the survey. This included, but was not limited to, any suggestions or recommendations for modifications or changes to the assessment questions or the survey in its entirety. Participant suggestions regarding assessment questions modifications include quotes such as, "Have you notified your medical providers that you are using cannabis products? For side effects, consider adding fainting." Among survey participants, there was an even distribution of healthcare providers who currently recommended cannabis for patients. Themes were generated and created by provider responses through latent thematic analysis. The first category looks at healthcare providers' support for items that separate appropriate and inappropriate cannabis usage. Suggestions were provided for diagnostic-specific questions to distinguish appropriate usage and inappropriate usage. The second theme addresses healthcare provider opinions of cannabis use in any appropriate context. There was a general agreement for defining an appropriate context or setting of cannabis use. 3 of the 11 participants that answered this question actually disagreed with recreational cannabis use in any context or supported medical usage only as an appropriate context for cannabis use. The chi-square analysis revealed that healthcare providers generally agreed that appropriate and inappropriate use of cannabis could be measured and separated as constructs. Healthcare providers also agreed that cannabis use, including medical cannabis use, could be accurately assessed using this cannabis assessment reliability and validity evaluation tool. The frequency of the figures revealed that there was an even distribution of healthcare providers that recommended cannabis to patients, and that there were support and suggestions provided for the items related to inappropriate and appropriate use of cannabis. There were limitations to the research, which included a small sample size and limited participation. The next logical research step would be to validate the CARV tool within the patient population. Inter-item reliability could provide an assessment of item redundancy and gauge how well the survey is measuring appropriate and inappropriate cannabis use. Ongoing research could also measure validity and reliability using exploratory and confirmatory factor analysis. This research study could be sustained by current and future research who want to continue to address the quality improvement of cannabis patient care and assessments regarding patients' cannabis use and misuse. This subject matter is relevant and timely, as evidenced by a recent study titled Nurse Leaders' Attitudes Towards and Experience with Medical Marijuana, which was published in July of 2022 in the Journal of Nursing Regulations. Results show nearly 90% of nurse leaders thought that people should be able to use cannabis legally to treat their medical conditions. 67% believe that nurses should facilitate access to medical cannabis for patients who would benefit from its use. Nurse leaders also identified the absence of institutional policies and clinical guidelines about medical cannabis as significant barriers to patients' legal use within healthcare settings. Only 14% of nurse leaders were aware of the NCSBN National Nursing Guidelines for medical marijuana. 85% believe that education about medical cannabis should be provided in pre-licensure nursing education programs. And lastly, nurse leaders acknowledge that they lacked education and were unaware of existing guidelines on the topic. In conclusion, the majority of healthcare provider participants showed approval for the following attributes of the CARV tool survey. Agreement that the tool provides a complete assessment of cannabis use, a complete assessment of medical use, and that appropriate and inappropriate cannabis use could be measured and evaluated. Suggestions for modification were also provided by the participants of the study. This project serves as a reminder that times change, information evolves, and science is constantly discovering new facts and data to support shifts in healthcare practices. This project is an extension of this newfound knowledge and includes observations and assessments made during time spent in the acute inpatient psychiatric setting, where stigma and gaps in knowledge are directly impacting patient outcomes. This project is a starting point for meaningful change and is necessary to continue evolving our evidence-based nursing practice. I would like to end this with a quote from Ralph Waldo Emerson. "Do not go where the path may lead, but go instead where there is no path and leave a trail."